I'm Melissa Gordon-Ring. I am the global president of Omnicom Media Health. I help lead a practice of healthcare experts across the Omnicom media portfolio, some of the largest pharma businesses and mid and small. We love them all. Bring together a community of experts as well as best practices, process, tools, thought leadership, and all the great stuff that keeps this business going.
Love it. So thinking about the future of healthcare, when you look to 3, 5 years ahead, what do you think is really going to change this industry in a meaningful way?
Honestly, I think we haven't yet seen the future of personalization. We keep talking about it. We have so much information and data at our fingertips, but I think the personalization aspect of what it is that we do is going to literally explode. I think from a content standpoint, I think from a timing standpoint, I think literally from location, we are literally going to see the convergence of something incredible when it comes to meaningful and more personalized experiences that feel natural and almost organic, and hopefully help us make better healthcare decisions faster and more easily and understandable. Because I think sometimes that can be the biggest challenge, is making sure you really know what's happening within your body or the choices that you have. So better choices and faster.
What do you think that the industry needs in order to move in that direction?
I think it needs bigger innovators and people who are less afraid. Um, I think we also need more coming together, more advocacy as an industry across the board, agencies, clients, partners, thought leaders. We are all in this together. We all have the same goal. We just want to help more people or give them the options to know that they have more help.
Right.
And if we can think about what the future could look like, and then we have a North Star, hopefully we can help keep each other accountable getting there.
When you think about the future and the industry, and also honestly just what's going on now as well, where do you feel like the industry actually talks a big game but isn't quite there yet?
I think AI, by far. We talk so much about it, and so many clients think that this is also the solution to a lot of their challenges. And it is a solution for a lot of things. But the reality is we have only just scratched the surface, and being able to harness the power for good and really being thoughtful as to what we are using it for, how we are activating it in a way that is thoughtful and compliant and privacy safe, but more importantly, allows us to make better decisions faster, because we always need that human in the loop, especially when it comes to healthcare, because healthcare will always be personal.
How are you navigating that conversation amongst your teams and with clients to bring some thought leadership and encourage people to bring their perspectives around what you're saying about it being a little bit soon?
I think we're all in it together,
Yeah.
right? And everyone has a different level of not just exposure, but experience when it comes to utilizing AI. I think we have to continue to balance and do check-ins as to how far have we come? How are you actually using it? Where did you see it was helpful? Because I'll tell you, the times where it's not as helpful is going to be even more important for everyone to learn from.
Right.
But also ensuring that there is a specific cadence to have those conversations. Like, how have we progressed? Have we not progressed? What are we seeing? What's useful? And then let's move on. But being honest and transparent through the entire journey.
Right. And thinking about your team, Omnicom, what are you guys doing to be ahead of the curve?
I think now that we're a part of this larger organization, we have such an incredible advantage in terms of the not just the number of experts, but the passion that lives within those experts.
Yeah.
And our ability to harness not just our presence in the marketplace, but tools and processes that were built specific for healthcare. We are trying to stay ahead of the curve and building a vision as we speak as to how we show up best, not just for our existing clients, but for new ones and working with partners.
How are you thinking about prepping your teams and the overall organization about what's to come and the future?
I think that's a great question because nobody knows. And if they say they do, they're lying. I think the reality is we have to push one another to wear multiple hats. Well, so many of us on the agency side too have been living in these specific groups and responsibilities. And I think we have to go outside of our lanes a little bit more and then push one another to do so. Things are changing on a daily basis, and it's hard to change. Change is one of the hardest things that happens to us as humans, especially things that you don't choose, right? And change is happening all around us. How are we also training our teams to understand what that impact looks like and instilling, change management protocol wherever we can?
Right. For the healthcare marketers that are listening, what do you advise that they start doing now so that they're not playing catch up in the future?
Tell your agencies everything. Bring them in to all of the conversations. It will make everything better. And if you see them truly as an integral part of your team, not only will they feel that, but that will come through in the partnership and the work. Don't be afraid to share.
Bring them in early.
Wrap your arms around them, and then share your goals. Share everything that you want to be able to achieve, because the more that they know, the better they can help you solve. And as agency partners, it's like in our lifeblood to figure out how we best create solutions and partner. And that's what makes us feel good.